Most of the cases of measles are centered in 5 western states.
Although the disease has not hit Wisconsin, local school districts are keeping a close eye on the situation. News 8's Kyle Dimke joins us now from our newsroom with more. Kyle.
Well, the measles are so contagious, 90% of people who are not vaccinated and then come in contact with a person with the measles will become infected. And because it is so contagious, school districts here in western Wisconsin are being proactive about an outbreak, even if it is hundreds of miles away.
Before entering kindergarten, state law requires children to get 2 doses of the measles, mumps, and rubella, also known as the MMR vaccine.
Parents do have the option to waive the vaccination.
A parent can choose for their child not to be vaccinated for personal, religious, or medical reasons. And state law requires school districts to keep that information on file.
If there were a case of measles to come into the area or any other vaccine preventable illness, we run our list of waivers and contact those parents if their child has been in close contact with someone or could be at risk of getting the illness.
But the state says that the students who are unimmunized, we have to give them their names and they should be excluded from school until the outbreak has passed.
If an outbreak were to happen, any unvaccinated students would most likely be asked to stay home from school for around 3 weeks. And while some have expressed concern about the privacy of medical information under HIPAA laws, it is legal.
Vaccines, I think, are pretty open record for that reason.
Both the La Crosse and Holman school districts say they hope the measles outbreak doesn't reach their schools. So to prevent that, district nurses need to start paying attention to the situation hundreds of miles away.
We watch for all sorts of communicable disease outbreaks.
If any disease such as the measles or whooping cough occurs, the county health department is immediately notified and it gives direction on how to handle the case. Now from there, how the county handles the situation varies depending on the disease and the amount of cases reported.
Thanks a lot, Kyle. Now, measles spreads in the air through a cough or sneeze. The disease starts with a fever, runny nose, cough, red eyes, and sore throat, and is followed by that telltale rash that spreads all over the body. Doctors say only 2 doses of the measles vaccine are needed for your lifetime.